Today I'm going to talk about one of the most commonly sought after cosmetic surgery procedure, that is rhinoplasty, or in simple terms nose job. Hi, this is Dr. Ekta Mishra. I'm consultant cosmetic and plastic surgeon at GBL Hospital Indore. Rhinoplasty is a procedure in which we change the shape and form of your nose in order to make it look more pleasing and aesthetic. It is mostly done for cosmetic concerns, but there is a functional component to it also. Sometimes, due to deviation of your nasal septum, there could be breathing difficulties as well, and this can also be corrected by rhinoplasty. Today in this video, I'm going to tell you how this procedure is done, who all can opt for rhinoplasty procedure, how is the post-recovery phase, what all precautions you should take after this procedure, and how safe is the procedure. So, who all can opt for a rhinoplasty procedure? So it's very simple to understand that anyone who is not satisfied with the form and size of their nose, they can go for rhinoplasty. Like if suppose you have a very broad nasal base, then you can get it narrow by this procedure. If you have a crooked nose because of deviation of the septum, this part of the nose, then it can be corrected by rhinoplasty. If you are not satisfied with the tip of your nose, you find it to be very elongated, or you find it to be very broad, or you find it to be upturned, in that case also it can be corrected by rhinoplasty. Apart from this, if you have nasal hump, or if you have an extra skin bridge over the upper part of the nose, that can also be corrected by rhinoplasty. Again, if you have a depressed bridge of the nose, if you find that the upper part of your nose is slightly depressed, that can also be elevated with the help of rhinoplasty procedure. Sometimes patients, they are not satisfied with the upper part of their nose and they find it to be very broad. That can also be corrected by rhinoplasty procedure. How do we do this surgery? This is mostly done under general anesthesia, and depending upon the patient requirement, that means what all procedure needs to be done, the time of duration of the surgery might vary from 45 minutes to about 3 to 3.5 hours as well. We do it by two approaches. One is open approach and the other is closed approach. In open approach, we give an incision over the base of the nose, and then we extend both the incisions to both the nostrils and try to raise a skin and soft tissue envelope and do the procedure. However, in case of closed approach, we give incision only inside the nostril and do the procedure. Both the approaches depends upon the discretion of the surgeon and the requirement of the patient. So how do we go for individual procedures? Like for allo-based reduction surgery, if you want to narrow the lower part of your nose, a simple incision, elliptical incision is given over the lower part of the nose, and skin and soft tissue can be removed from here, giving you a narrow nostrils. If you want to get your tip modified, in that case, we can use sutures, or if there is a deficiency of cartilage at the tip, we can bring cartilage from other parts of their body, like from ear we can bring cartilage and put it here in order to elevate the tip of your nose. If you have deviated nasal septum, that can also be corrected by a procedure that is known as septoplasty. This, when combined with rhinoplasty, the procedure is known as septorhinoplasty. In case of deviated nasal septum, patients mostly have breathing difficulty as well. Apart from the cosmetic appearance, that sometimes they might have a crooked nose because of deviated nasal septum. Both these things can be corrected by septoplasty. In this case, we remove part of the cartilage of the septum and make it straight and in the midline, so as to improve the appearance of the nose. By this, your breathing difficulty can also be corrected. If you have a depressed nasal bridge, then of course something needs to be added here in order to elevate this part. So we take cartilage from other part of the body and we try to place it here in order to elevate it. Like we can take cartilage from your chest, from the septum itself, or sometimes from the ear to elevate the bridge of your nose. If suppose you have a nasal hump, that means the bony part or the cartilage part out here is elevated. That can also be corrected by removing the extra cartilage or the extra bone out here. If suppose a patient has broad nasal base, that can also be narrowed down by removing the part of the bone by using a very simple instrument, that is osteotome, and we can break your bone and make it narrow. All these procedures come under rhinoplasty, under one roof, that is rhinoplasty. Patient can be discharged 1 to 2 days after the surgery, and he or she can resume their daily activities just 2 to 3 days after their surgery. Immediately after the surgery, we give a splint over the nose, which has to be kept for 7 to 10 days. We also give a nasal pack inside the nostril, which needs to be removed after 24 to 48 hours. And he or she can resume their daily activities within 2 to 3 days. Yes, but of course, for the social meetings and all, he can go after 10 to 12 days once the splint is removed. There is slight swelling and bruising after the surgery. The bruising, it goes off within 10 to 14 days. However, the swelling, it takes a little longer time to subside. The tip swelling is the last to go, which takes about 9 to 10 months. So in order to have the best results seen, you need to wait for 10 to 11 months in case of rhinoplasty. In this video, I have tried to make you understand all about rhinoplasty. But in case you have any queries related to this, kindly contact our team. Thank you.